The CORALREEF lipid trial. Efficacy and safety of enlicitide, an oral PCSK9 inhibitor for lowering LDL cholesterol in adults with or at risk for ASCVD. Enlicitide decanoate is an oral PCSK9 inhibitor which works similar to the monoclonal antibody by binding to PCSK9 and preventing its interaction with the LDL receptor, leading to upregulation of LDL receptors and improved clearance of LDL cholesterol from the bloodstream. In spite of a number of effective therapies to lower LDL, far too many patients have failed to achieve guideline-recommended targets. And although injectable PCSK9 inhibitors offer powerful LDL reductions and cardiovascular outcome benefit, they are underutilized. In phase 2 studies, enlicitide lowered LDL cholesterol by up to 60% in short durations. The CORALREEF lipid trial was designed to study the efficacy and safety of enlicitide over 52 weeks. 2,912 subjects were randomized in a 2-to-1 ratio to 20 milligrams of enlicitide or placebo and followed for 52 weeks, with either an 8-week safety follow-up or continuation in an open-label extension. Participants had a prior atherosclerotic cardiovascular disease event, an LDL cholesterol of 1.4 or greater, or at risk for a first major ASCVD event, and an LDL greater than or equal to 1.8 millimoles per liter. All participants had to be optimized and on stable background lipid-lowering therapy with at least moderate or high-dose intensity statin or documented statin intolerance. Key inclusion included an ASCVD event in the past 3 months, active or recent treatment with PCSK9 inhibition, uncontrolled diabetes, or triglycerides greater than 4.52 at screening. Here are the baseline characteristics. Mean age was 63 years, 40% were women. You can see the global participation with a high ethnic and racially diverse population. 26% of participants were Asian, 9% were Black, 28% were Hispanic. 58% of participants had a history of a major ASCVD event. The remainder were enrolled because they were at risk for cardiovascular disease. At baseline, 97% of patients were on a high-intensity statin. The vast majority of those were on moderate or high-intensity dose. Use of cholesterol absorption inhibitors like ezetimibe was 26% overall. The mean LDL was 2.49 millimoles per liter. For the primary endpoints, there was a 3% increase in LDL in the placebo group and a 57.1% decrease in the enlicitide group. The placebo adjusted between group difference was 55.8% at week 24. This effect was sustained over time with a persistent 50% reduction in LDL at 52 weeks for a least squares means between group difference of 47.6%. Here are the key secondary results at 24 weeks. There was a 53.4 reduction in non-HDL, a 50.3 reduction in ApoB, and a 28% reduction in Lp(a). In terms of achieving guideline-based goals, when adding enlicitide to background statin therapy, the pre-specified targets were at least a 50% reduction in LDL and LDL less than 1.8, or the 50% reduction and LDL less than 1.4. In those receiving enlicitide, 70% of participants achieved LDL goal less than 1.8, and 67% achieved the goal of less than 1.4, a significant difference compared to a placebo. Enlicitide was very safe and well tolerated. The number of serious adverse events was 9.9% in the enlicitide arm and 12% in the placebo arm. Discontinuation due to adverse events was also numerically lower in the enlicitide compared to placebo. Of note, there was high adherence to fasting instructions, which required individuals to take the drug after an overnight fast, first thing in the morning, and abstain to drink for 30 minutes. 97% adhered to this instruction. GI side effects were the same between the both groups, reinforcing the safety of this oral agent. Given the similar biological effect between enlicitide and the monoclonal antibodies, PCSK9 inhibitors, they observed remarkably similar reductions in LDL cholesterol, non-HDL cholesterol, ApoB, and Lp(a) compared to the phase 3 studies of alirocumab and evolocumab. Inclisiran has a slightly different mechanism of action because it blocks the production of PCSK9 in the liver, but there may be some extrahepatic PCSK9 synthesis, so they saw slightly lower reported numbers for that drug compared to other PCSK9 inhibitors. So in summary, in a diverse global population of participants with or at risk of vascular disease, once daily enlicitide demonstrated PCSK9 monoclonal antibody-like effects at 24 weeks, with sustained reductions in LDL cholesterol and other atherogenic lipid proteins through to 52 weeks. Majority of participants achieved aggressive LDL goals that aligned with current guideline recommendations. Enlicitide was safe and well tolerated with a high participant-reported adherence.